My name is Emily Carrara, and I am the Recovery and Prevention Programming Supervisor at Amoskeag Health. The thing that I wish more people understood about MAT and the work that I do as a recovery support worker, I guess it's multifaceted. The first one would be that MAT is a tool for someone's recovery. It is not substituting a drug for another drug. It's also not for everyone, and that's okay. What's for one isn't necessarily for all. Things work for different people, and my job is to support them no matter what works for them. I have plenty of patients who don't utilize any MAT. There are people who come in from the primary care side who just want recovery support and love going to meetings and AA. That's excellent. Awesome. I have some patients who really rely on MAT to stay sober, and that's great. I'm here to support them either way. Recovery isn't necessarily a linear path. When that day comes that people decide to make a change, that doesn't mean it's going to be no hiccups along the way. Everyone, for the most part, has at least a slip, a backslide, a relapse, whatever that looks like. That doesn't take away any of the progress that person has made up until that point. And being able to affirm that to clients is so important because shame is a huge piece of addiction. Being able to take some of that pressure away from them and affirm for them that mistakes happen, things happen, life happens, and that's okay. That does not take away all the progress that they've made. I believe that having that lens has really transformed the way I'm able to meet patients where they're at and help them understand their own journey and make sense of a lot of the things that do happen. There's so many things that happen outside of our control, and that's all right. How do we move forward from that together is really the key to sustained maintenance. Addiction is not a choice. Addiction is a disease. It's an illness. People don't choose to sacrifice all of their needs to a drug or alcohol. And understanding that is so important. When we look at the person, separating the addiction from the person is crucial to delivering effective person-centered care. And it really helps see the human behind the illness and really keep that hope alive. But staying motivated starts by focusing on the hope and all the success that can come from someone who makes it through and out of addiction. Addiction never leaves the person's life. It's always there. It's always going to be kind of on the back burner, but the more that we can support them in creating distance between that and focusing on the life that they love, the better the outcome is. It's something that's really important to keep in mind when we think about prevention. Often, for years and years, I don't think people really connected the world of prevention to recovery, when the reality is they are all interconnected. Substance use exists on a spectrum. So you have prevention over here, you've got the in-between, the harm reduction, and then you have the recovery piece. But really, if you can picture it, it's more of like a cycle, a circle. So we start with prevention. Typically, you see that in the youth population. Before anyone starts using substances, you're trying to prevent that from happening, of course. Big thing with substance use is that accepting the truth, that is, you can try to prevent as much as you want. The reality is people are probably still going to do it. Some part of the population is still going to do that, and that's just a fact. It's not an opinion. So when we get there, we want to make sure people are doing it safely so that they can stay alive long enough to make a different decision. That's the principle of harm reduction that's so important. You move into recovery, which is a lot of the people in MAT, people, adults who are, abstaining from substances, this and that. It doesn't end there, though. We go back into prevention because when someone is sober and abstaining from substances, we want to make sure that they don't go back to using. And so that's where that prevention comes into play. It's so important to acknowledge the spectrum for a couple of different reasons. One, it's acknowledging, the life cycle of substance use. It can repeat, it can start as a kid, it can also start as an adult. Everyone's story is different. But not acknowledging one part of that spectrum can be extremely detrimental to the individual. If we don't look at the fact that people are using substances and the risk of death is pretty imminent for people who have zero protection, then how are we working to keep that person alive long enough to make a different decision? Doesn't work without harm reduction. So acknowledging that middle part is crucial to moving to recovery. Acknowledging prevention is crucial to keeping someone in recovery. It all kind of works together in a really cool, synchronous way. And that's what continues to drive my passion, my work, and honestly, like the bigger picture of working in substance use.